Let's understand the anatomy of kidney. Kidney is the most important part of our urinary system. It is been shaped, having length of 10 to 12 centimeters, width of 5 to 7 centimeters and average weight of 120 to 150 gram of each kidney. It is located below the rib cage, either side of the vertebral column, between the 12th thoracic and 3rd lumbar vertebrae. Right kidney typically slightly lower than the left due to the liver's position. Its anterior surface faces the abdominal organs like liver, spleen, duodenum and ascending colon, while its posterior surface is in contact with muscles like diaphragm, quadratus lumborum muscle, and transversus abdominis muscle. Its medial border is concave, meaning it's curved inside, and lateral border is convex, meaning curved outward. Medial border contains hilum, that is the entry and exit point for blood vessels, lymph vessels, nerves, and ureter. Its upper pole is close to the midline and capped by adrenal gland, while lower pole away from midpoint. It is protected by 3 layers of capsule. The first one is renal capsule, which is the innermost layer and also called fibrous capsule. This layer is thin, tough, and transparent, provide protection from infection and trauma. This also maintain the shape of kidney. The second layer is middle layer made up of fat and called perirenal capsule. This layer provide protection from any mechanical shock and injury, hold kidney in place within abdominal cavity. The third layer is renal fascia, which is the outermost layer, encloses both kidney and adrenal gland. This layer is thin but strong, made up of dense connective tissue. It anchors kidney by keeping it place and separate from surrounding structure. Now comes the internal anatomy of kidney. There are 2 regions of kidney. Renal cortex is the outer region. This region contain renal corpuscles, proximal and distal convoluted tubule. This region extend inward between pyramids called renal column. Renal medulla is the inner region of kidney. This region is made up of cone-shaped renal pyramids, which contains loop of Henle and collecting duct. The tip of renal pyramid is known as renal papilla. Minor calyces collect urine from renal papilla. These minor calyces join to form major calyces. The renal pelvis is a funnel-shaped cavity that collects urine from the calyces. Renal sinus is a central, fat-filled cavity, contains the renal pelvis, major calyces, renal arteries and veins, and autonomic nerves. Nephron is the functional unit of kidney. It consists of renal corpuscle and renal tubule. Renal corpuscle has 2 parts, glomerulus and Bowman's capsule, while renal tubule consists of proximal convoluted tubule, loop of Henle, distal convoluted tubule and collecting duct that carries urine to renal papilla. Juxtaglomerular apparatus consists of juxtaglomerular cells and macular denser cells. JG cells are present on afferent arterioles. These cells have mechanoreceptors which respond to changes in blood pressure. Cells contain vesicles that release renin in response to decrease in blood pressure. Macular denser cells are present on distal convoluted tubule and have chemoreceptors that regulate the chemical concentration in blood. Renal artery coming from abdominal aorta enters into kidney that divide into segmental arteries that supply blood to each segment of the kidney. Now segmental arteries divide into interlobar arteries that supply blood to each lobe, which consist of renal pyramid and cortex tissue surrounding it. Interlobar arteries give rise to arcuate arteries, that are arc-shaped vessels around base of pyramids. Arcuate arteries divide into cortical radiate arteries, also known as interlobular arteries, that supply blood in the cortex region. These arteries supply blood to afferent arterioles that provide blood to glomerulus. Glomerulus is drained by efferent arterioles, which branch into peritubular capillaries supply blood to cortical region. In renal cortex, peritubular capillaries join to cortical radiate vein, which join to arcuate vein. Now arcuate vein joins into interlobar vein, which then drain into renal vein. Finally renal vein leave the kidney and join inferior vena cava. However, in the medulla region, these peritubular capillaries coming from efferent arterioles are called vasa recta, and they supply blood to medulla region or juxtaglomerular nephron. It maintains medullary osmotic gradient and play important role in counter-current mechanism.